If you're just joining, you can just chat in your name, your organization, and your role. But other than that, we'll get started. Katie, can you go to the next slide? Great. So kicking it off, we're going to introduce you to the project leads. So first of all is Katie Breen. She's a vice president of programs. Then there's myself. My name's Elena Sayers, and I'm the project manager. And then Stacy Sandy, who is our data analyst. If you ever have any questions, you can reach out to us. And if you want to reach out to all three of us, you can email us at info@cpcqc.org. You can go to the next slide, Katie. So now let's introduce y'all to you all. So we have one new team joining the collaborative this year. We want to give a warm welcome to Rose Medical Center. We're really excited for them to join the collaborative. They're the hospital in the state with the largest birth volume. So we're really excited for them to join the collaborative and work alongside the teams from 2021 to improve the patient safety in Colorado. Next slide. So we just wanted to quickly review the 2022 program components. So if you look at the beginning of the timeline, in February in the purple section, we're currently in the ramp up period and the prep period, kicking off now in February, and that ramp up period will go to March. And then in April, teams are going to begin collecting quantitative data, and then they will submit that in July, which will be a quarterly period. And you'll continue to do that for the rest of the year. And then each month you will submit your qualitative data starting in March as well. You can go ahead. We just wanted to remind you of a few key dates. So we have the monthly coaching calls. This is the first one of the year, and we're very excited. But they occur each month, the second Thursday of the month from 12 to 1 p.m. The second one is that for all new teams, we would like you to schedule an expert training for your staff. We just ask that you have that scheduled by March 20th, but it doesn't have to occur before then. And then we have the first qualitative reporting survey that's going to begin on March 1st. You can go to the next slide, Kitty. So in those monthly coaching calls, today is the February 10th kickoff, but each month we're going to have different key topics that we're going to be touching on. So here you can see a list of the different topics, and these are based off of both the topics that we did last year, as well as your feedback from last year and what you might want to hear as well. And so these are the key topics. In addition, we're going to have 30 minutes during those coaching calls for team presentations. So each team is going to be assigned a date, and during those times, you're going to share out about your challenges, your successes, different tools that have been good for you, and just so that we can work together and collaborate and improve from each other's successes and challenges. Next slide. So these are the dates that we assigned to you. The first presentations will begin in April. And if you need to switch, that's fine, just email us. But we've paired you all together, except for September. But each presentation will be about 10 minutes long. And we have a presentation template for you, which we'll send to you in our follow-up email as well. Next slide. So a little bit more about that data cadence that we were talking about. The qualitative data will begin in March, and that will be monthly. And that qualitative data is simply reflecting on your experiences. For the 2021 teams, it's the same as what you did at the end of your data submissions, that 30, 60, 90-day plan. And then quarterly, we're going to be doing that quantitative data. So we're going to be collecting from April till June and submission in July, and then July through September collection with submission in October, and then October through December collection with submission in January. Next slide. So finally, I want to talk a little bit about what we're going to do as a culture change survey. And we just want to see if you as the champions and what you're learning is also being transferred to the rest of your unit. And so you as a unit can be improving as well. So we're going to be implementing a culture change survey, and it is going to be sent out to the registered nurses in your unit. And so what I'm asking of you all is that you can distribute this to your listserv or your whatever kind of email platform that you use, so that all the nurses in your unit can answer this quick. It's a 5-minute survey by March 10th. And I will be sending that out in the follow-up email. And if the nurses complete both the pre and post survey, they can be entered in to win a $50 gift card. And so we'll have one completed in March and then one completed in November as well. Next slide. So now Katie's gonna talk about the pillars.
Sorry, I think we're on a delay because I have the slides. Hi, I'm Katie Breen. I'm the VP of Programs. You've probably seen me before if you're here. And yeah, I just want to reiterate how excited we are that you are all here and that we have all of our 2021 teams continuing on with us. And then super excited to have Rose join this year. And yes, so just a quick reminder, because I know we had a couple people join in the time since we had the welcome. Please chat in your name and organization and your role there. And if you're with an outpatient team, please let us know which hospital you're here with. And just a reminder, all of these slides and the links and stuff will be shared after the call. So no worries about jotting this stuff down. So on to what I wanted to talk about. So one of the things that we reflected a lot upon in terms of the 2021 collaborative was that we felt sometimes that, we talked about the change concepts at the beginning of the collaborative when we were really introducing the patient safety bundle. But we felt that once teams started, really getting going on implementing, we didn't do as well as I think we could have in terms of bringing it back to why we're doing what we're doing and what the change concepts are. And really thinking of the change concepts in buckets, because as you know, there are a lot of different components of this bundle. There are a lot of different things you could change, you could work on, you could do education on. And it can feel super overwhelming to be like, oh gosh, there's this whole universe of different things you're doing in our unit. And it can be overwhelming. It can feel hard to know, like, okay, what are we focusing on? What do we want to focus on next? So this year is really make sure we're communicating clearly a way to think about the change concepts that you could be working on as a means of thinking about what you want to prioritize. So we wanted to present this model to you today that we hope is helpful, and we hope, we're planning to sort of revisit throughout the collaborative in a way that we really didn't revisit the bundle structure last year, and hoping it just helps us like ground ourselves and feel less overwhelmed. So I want to explain sort of what this model is all about. So ultimately, of course, we are here because we want to save lives and we want to improve patient care. And so patient care is obviously at the top of everything we do. And then this second part is implementation. And of course, you're in a quality improvement learning collaborative because you are here to implement. And what we are here to do as CPCQC is support you in this implementation. So as you know, what we will provide during this collaborative is technical assistance and coaching, provider education, data support for implementation. And that's what we're here to do so that we can help you implement. And we will go into the 4 main pillars next, but we wanted to really highlight the 3 sort of pieces of foundation on the bottom: stigma and bias, disparities, and social determinants of health. Those are things that, in everything we do, we strive to address and shed light on and figure out how to alleviate these things through everything that we're doing. So they're really something that undergirds all of the work that we're doing this year. And we hope that will, become clear. So going into the first of these pillars, I'm going to go through each of these pillars and basically discuss some of the change concepts that could fall under them. I want to say, so that again, this isn't overwhelming. This is not an exhaustive list of the sorts of change concepts that could fall under each pillar. And it's also, they're also just ideas and examples. We're not saying you need to do every single one of these change concepts. The point is to sort of provide a menu of options or suggestions for things that you could work on under each of these pillars. So I'm not going to read all of this. We'll provide you a sheet so you can read it yourself later. But under the protocols pillar, of course, this is what a lot of this collaborative is about. And you might choose to work on change concepts under protocols, such as creating protocols for universal screening, using a validated tool for substance use disorder, or changing the way you do screening so that, if right now it's a sort of a verbal conversation about, okay, let me read this screening form to the patient, having a way so that it's really self-reported to increase, the patient's comfort and their truthfulness in response. Could be things like making pain management protocols for patients with opioid use disorder, revising your toxicology testing protocols. So these again are just ideas for things that fall under protocols to give you an example of some of the things you could work on if you were to choose to work on protocols. Just a reminder, we have examples of everything above. So all of the change concepts we discussed today, again, we don't want you to feel overwhelmed. We are here to support you in implementing any of them. And we have a ton of resources and connections to help you with any change concepts that you want to implement. So we hope you take away from this. These are ideas and suggestions and things that can really help you do. Don't feel like this is overwhelming. We're going to have to do this all on our own, because we've been doing this for a while and we have set ourselves up so that we can help you do it. Moving on to the next pillar, data collection. So of course, there's a couple different areas where data collection comes in here. One is just data collection for patient care. So having a process for documenting that a screening took place and then documenting the result of that screening. Having hard stops in your EMR so that screenings and documentation and elements of the care protocol take place and are documented. And then, of course, quality improvement involves data collection, because we can't improve things if we don't know how we're doing. So thinking about data collection processes for QI, so establishing process to collect the data elements for reporting, which we'll talk about a little bit later today. Working with your EMR or IT team to help automate changes, reviewing the quarterly or the monthly reports that we send you. And again, CPCQC would be thrilled to help you with any of this and to meet one-on-one and do whatever we can to help you get to a place where you can work on data collection. The next pillar is education. Of course, a huge part of this collaborative is education, which is why, we have these monthly coaching calls where in the future we'll have a subject matter expert talk about a particular topic related to the bundle. But of course, there's all sorts of education you can be doing. A lot of education that could take place on behalf of your staff. So getting staff trained in SBIRT, creating a process so that you can inform any new staff members that join of sort of what's going on and the point of this project so that you can really hardwire changes into your process. Becoming DEA X waiver to prescribe buprenorphine. Learning about things like trauma-informed care. And then of course, being able to educate your patients on recovery services, on, what's going to happen after they screen positive, all of that stuff. And a ton of resources about all of this. And then the last pillar is coordination. And this is something we're going to be talking a lot more about this year compared to last year. We feel that, you know, many of you have been in this collaborative for a year. You have started the process or gotten to a really good place with your process of making sure that patients are being screened. And now the next step is making sure that if a patient screens positive, they are cared for in the most comprehensive way possible. Because what's most important isn't if they screen positive, what's most important is knowing, you know, what to do after they do screen positive, because what's the point of screening if we're not going to help them afterwards? So we're going to be talking a lot more this year about coordination between inpatient and outpatient OB settings, as well as between your hospital and local resources in the community that can provide specialized care, especially for perinatal patients, SUD patients, social services, things like that. And really just thinking about the fact that, you know, there's no point in having the inpatient unit as a stopgap for screening and identifying patients with behavioral health concerns if we're not then working on coordination, because they're going to be out of your care in 2 days. And then, you know, what's the point of screening if you're not going to help them outside of your walls? So coordination is what we're talking about more this year. And again, we can help you with all of that. So the next thing we're going to do is take 5 minutes for some team time. And we have prepared a worksheet that Elena will put in the chat that puts all of these change concepts and pillars into one document so you can see them all in one place instead of in 5 slides. And we'd like for you to discuss with your team, if you're here with your team, or alone, if you're here alone, which pillars or change concepts you'd like to focus on in the 30 days. And think about, as you identify those, what's challenging about focusing on that particular area? Like, why haven't you done it before? And what assets do you have to help you? So, Elena, I think you might have direction about breakout rooms or pauses.
I'm just finishing making the breakout rooms. There's a lot of you, so I'm just going to put everyone in their associated rooms. I just put the link to the sheet that Katie is referring to in the chat. In just a few moments, I'll send you to your breakout rooms. So just give me one moment.
And I know we have a lot of folks today, more than we expected, who are not necessarily part of a hospital team. What should we instruct those folks to do?
I think that if you're not paired with a hospital team, we can keep you maybe in a second room that maybe you can discuss different things that you all can work on in your organization. How does that sound, Katie?
Sounds good, yeah.
Okay. Sorry, it's taking me a moment.
Okay, I know there are a lot of people, so it's hard to get all those breakout rooms coordinated while I'm talking.
Yes, it's a lot of multitasking.
Luckily, we're actually running 5 minutes ahead of schedule, so it's okay.
What would be helpful too is if you haven't chatted in, if you could put yourself in the chat, that would be helpful for me just to know where you're calling in from. I'm good, but I'm not that good. Okay. I'm going to put you all in your rooms, and if you didn't get put in your room, I can add you in after. Okay. You will all have 5 minutes, okay? If you haven't been added to a group, just let me know which hospital or organization you're with, and I'll add you to your assigned teams.
For everyone who is here who's not necessarily part of a hospital or a group, definitely encourage you to look at the worksheet we shared in the chat anyway, and sort of look at the change concepts we're discussing. And maybe you can think about, from the various perspectives you lend to this work, if there's a certain area that you could see your organization helping to support in terms of, if hospitals are working on coordination, for example, there's a resource you could lend or perspective you could lend to help them better connect with an outpatient clinic or better connect with community resource. Especially because, as we said, we're always helping connect our teams to resources that we know about that can help them with these things, such as connecting them to nurse family partnerships so that they know about nurse family partnership. But sometimes you all have programs and resources that we don't know about. So the more we know, the more we can help connect you to people.
Is there anyone here who hasn't been added to a group that should be? No? Okay, I'm going to close the groups, and it usually takes them about a minute to come back. Welcome back, everyone. Seeing you all populating on the side screen. So now we're going to quickly talk about PDSA cycles. So Katie, you can go to the next slide.
Oh, wait, actually.
Oh, unless you want to talk about something too.
Yeah, just quickly, because we actually have time.
Okay.
For the hospital teams, we would love to hear what you talked about. If someone from your team wants to volunteer to share what you're thinking about focusing on.
Hi, this is Mick from Valley View, and we are going to work on our data collection. We're pretty good in our other areas, but I think our data collection can be better. We're really in a good place with a lot of great things happening right now. And so working with our IT team to kind of help extract some of that from our medical records, at least in the hospital, and even women's health has really got a good system going, but that's where our focus is going to be for both of our teams. Women's health and the hospital are going to kind of focus on that, along with all that's going to be our main focus.
Great.
Hi, this is Anne from University. Megan and I have been working with our perinatal behavioral health pathways program as well, and they had made a really nice process map that we're going to try and implement algorithm of making sure that every patient that gets screened positive gets treated the exact same way 100% of the time. And the very first part of that we would like to initiate is that how do you get to talk to the patient privately on admission to inpatient just for a couple of minutes. So that's a tough thing since it's never been done in our organization before, but that's where we're going to start.
Great. Anyone else want to share? No? Okay, we will move on.
Katie, if you want to go to the next slide. So now we're going to quickly talk about PDSA cycles, and this is a QI principle that's focused on small tests of change and how you enact them. So like Katie was saying with the pillars, these are all like the big goals to achieve through the Learning Collaborative, but to achieve each of those goals, you have to do a lot of small tests along the way, and it doesn't all happen overnight. So what we recommend is using these PDSA cycles. So the first action is to plan. So you think about, okay, what is that small test of change that I want to do? Is that making a poster? Is that sending out an email to the staff? Is that writing up what I think a good screening tool will look like on a piece of paper? Whatever it might be. The next step is the D, which is to do. You're going to run that test of change and write down notes on how you did with that. Next is study, which is you're going to reflect on what you did, compare it to what you've previously done, and see if it worked or if it didn't work. And the last step is act. See if you want to move forward or if you want to change something or what you want to do that might be different. And you repeat this cycle multiple times until you get to that main goal. And so we expect this to happen many, many times in the year. But it's just a method for you to track your changes and create a kind of a flow sheet of how you're going to do that in an effective manner. So the next part of team time, Katie, you can go to the next slide, is we're going to have you run through the PDSA cycle worksheet. Some of you have seen this, but basically from what you discussed during that pillar team time, we want you to think about what would be great next steps for you to do in the next 30 days to start to achieve those larger goals. So Katie's going to put in the chat the PDSA worksheet. Katie, I can do it as well if you would like me to.
I already did it.
Oh, you're still on top
It's
of it.
in the chat.
And we're going to put you into breakout rooms again. And this time it's going to be a little bit longer, so 10 minutes. And I want you to discuss as a team those small tests of change that you're going to do, specifically ones that you're going to do in the next 30 days to slowly make progress on your bigger goals. So I'm going to put you in those breakout rooms again. Now they're all set.
Lena, I am realizing, and everyone, this is my fault. Let's have this team time also just be 5 minutes. I realized that I meant for it to be 5 minutes, but I wrote 10 minutes, so I'm sorry.
Great, that's fine. And again, if you're not put in the right room, just chat in and I'll put you in the right room, but hopefully it works out better this time. So we're going to come back at 12:40. Okay, I'm closing the rooms. Welcome back, everyone. How did that go?
It was good. This is Kara from Valley View. We just need more time to, to figure out each of the steps involved, and
Yeah,
even ended up, I think, Mick, with a different aim than what we started with. So it was productive. We just need longer time.
yeah, that's good. Yeah, this is obviously an activity that takes longer than just 5 minutes.
But definitely save that worksheet
Yeah.
so that you can finish it with your team later. Actually, part of the next steps is for you to finish it with your team, and then also run your test of change, and then, fill out the S and A, or the D, S, and A sections of it. So we are going to move on and talk about data, because we know that it can be overwhelming. And we're doing the best we can this year to make it the least amount of overwhelming as possible. So what we wanted to talk about is, so as we discussed, for the qualitative data, which is monthly, it will not be a big time commitment for you to fill out. It'll be, if you were here in 2021, very similar questions to the sort of qualitative questions you answered before about, what support you might need, what you're working on, 30, 60, 90-day plans, very high level. And then we are changing the cadence this year, and instead of collecting data monthly, or I'm sorry, instead of collecting any quantitative data monthly, we're collecting it quarterly. And there are also some new measures. So we wanted to talk about that next, and sort of help you plan. So for the quantitative data, there are two types of data within that quantitative data, which again is due quarterly. And you'll start collecting it April 1st for April through June. And then you won't actually submit the quantitative data to us until July. So two types of data. There's the hospital level data, which is almost the same as the type of data that you submitted to us in 2021. So things like screening rates, the percent of patients who were admitted who were screened for SUD, for example, which we're hoping, you'll be able to gather via some sort of automation, EMR reports, et cetera. And then the second type of hospital level data is around your protocols. So these are yes, no questions, basically, that you've answered before, don't require any data or EMR stuff. It's things like, have you implemented a protocol for SUD screening? And you'll say, it's fully implemented. We're planning it. We're testing it. So no data collection needed for that. So that's the first type of data. The second type of data is patient level data. And this is new for this year because AIM nationally updated their bundle measures for 2022 because they want to focus on, what happens after a positive screen. So this patient level data, it's de-identified, and it is for any patient who screens positive for SUD. And the reason we want to talk about it is because it will require information that may not be in your charts and may not be possible to automate via EMR reporting. So, for a lot of you, for the last couple of months, we've been talking about this and preparing you for it. But what we've done since we last spoke is that we created a new tool. It's an optional tool. We'll talk about it to help you report this patient level data in a way that we think will make your lives easier. So just going to go into really quickly a review of sort of what we're talking about. So when we talk about hospital level data, I won't read all of this, but again, these are things like, has your hospital or has your department implemented a guideline for XYZ? They're yes or no questions. You don't need data for them. Again, these are sort of yes or no questions. They don't require looking at EMRs. It's about your staff and what your staff is doing. And then this is almost the same as the sort of numeric data you gave us last year, additions, but these are things that we believe would be not too difficult to get via automated EMR reports or to change things so that you can get reports for them. It shouldn't be super hard to get this. And then I'll go into the patient level data and explain why I think this tool that we're going to provide might be helpful. So you've seen all this before, but the patient level data this year is harder to automate in the EMR. And the reason for that is you would need to know if a patient screened positive for SUD or OUD. And then once you know if they screened positive, then the measures ask you about the sort of care that were given to those specific patients. So it's hard to automate that in an EMR because you might be able to automate like, okay, these patients had this ICD-10 code of a SUD diagnosis, but there aren't codes for, did we counsel this person on recovery treatment services? And they might be in your notes if people are like documenting that in notes, but it's not easy to pull that in an automated report, to see if something was contained in the notes. And then also this needs to be disaggregated by race and by payer because we're focusing more on disparities this year and it's a priority of AIM as well. And so AIM is asking for that. So what we think will make it easier is we have options for you. The first option is, and I'll show you what this looks like on the next slide, using a patient data sheet. This is optional, but we do recommend it. And what this would mean is that for any patient that screens positive for SUD, you would submit a patient level data form on that specific patient, again, de-identified. What the benefits of this method are is that you won't have to count anything. We'll aggregate it for you. You have to be like, I flagged this many charts for SUD, was counseled on naloxone. You won't have to do this. You will have filled out the information we need for each individual patient. The second benefit is you can complete the forms as you go. So like ideally right before or right after the patient is discharged, you will, be like, oh, okay, while it's fresh in your mind, let me fill this out for the patient so that you don't forget whether or not these different care things happened in case they're not documented. You can also do it in batches. You can input this directly online to recap, or you can print out these forms, complete it on paper, and then input them electronically to us later. And I'll show you what that form looks like in a second so you know what I'm talking about. The second option, and this, to be truthful, we think is the harder option, but some of you might have the resources to do this, and that's wonderful if you do, is to self-aggregate. So what that would mean is you would collect this data and you would aggregate it and submit it to us. And ideally, you would aggregate it via automated EMR reports. We realize, though, that is going to be harder for most of you to automate, which is why we offering this patient data sheet as the option that we would recommend. What I'm talking about here, and Elena just put a link to the patient data sheet we're talking about into the chat. So you can get a sense for what we're talking about. This is a draft. We can make it prettier and whatever. But the idea is that for each patient that screens positive for SUD, you fill this chart out. And it basically just goes into all of the measures. So like, did this patient have a consult with social work before they were discharged? Were they counseled on recovery treatment services? So you answer those for each individual patient. You don't have to worry about remembering later if these things happened or seeing if they were documented in the EMR or trying to automate this in the EMR. I have a question in the chat. Is this a form that we could attach to a chart without patient identifiers when a patient screens positive? I believe if I'm your question correctly, yes. I'm not sure what you mean by attached to a chart. So if you want to come off mute and ask that question, feel free. Basically, it will be provided at a REDCap link where like this form will be in REDCap and you can just enter it electronically, or we can send you, PDFs or Word docs of this sheet and you can print it out yourself or you can do it on your computer. So in terms of attaching it to a chart, I don't know, because I don't really know how you attach things depending on what your EMR is and how attachments work. But let me know if that answered your question. It would not be a part of the permanent record. However, it would be a good guide to help all involved in the care to ensure everything is being completed. Yes, absolutely. One of the things I didn't mention that there are two reasons we're really excited about this patient data form and think people should use it. One is because it's going to make your life much easier for data collection. But number two, it's that it really can serve as part of your clinical care checklist. We have examples of clinical care checklists that are more comprehensive with this or sort of ask the questions in a different way. But this really ensures that it gets done and that you're like, oh, okay, I'm filling out this sheet. This patient is about to get discharged. You know what? We didn't do this. And you have the chance to do it before they're discharged so that you don't have to say, no, we didn't do this, or I don't know if we did this. So yeah, I mean, we really like this because it's a way of ensuring it gets done, which is what we're all here for. So after having a second to reflect on that, just recommendations are you don't have to start collecting this data until April 1st. So please use the time between now and April 1st to strategize staff on how you want to collect this. Try out the patient data sheet, do some PDSAs or talk to your staff about the patient data sheet. Decide how often data will be collected, also submitted to us. We recommend that even though it's due quarterly, think about compiling it and submitting it more often than quarterly so that at the end of the quarter, you're not the amount you need to do, but B, you can essentially think of it as a PDSA role where you will know ahead of time if your process isn't working because you didn't wait until the end of the quarter and sort of like corrupt all of the records that you need to submit by the end of the quarter because you waited to submit. If you don't like the idea of this patient data form, think about other things. Utilization of physical logbooks, flagging patient charts when SUD is identified. Obviously work with your EMR stakeholders to automate things as much as possible. If you have Epic, you can create queues or dot phrases to ensure that all the needed information will be in the chart. Just remember that that is not going to be easy to report on because it won't be easy to pull reports from dot phrases or from notes. So again, that's why we think this patient data sheet is great, but we want you to do what's going to work best for your team. So that's why it's an option. So, and then lastly, meet with us before April 1st to strategize because we are here and would love to meet with you to help you figure this out. So as a sort of check in on how you're feeling about this, we just put a poll up if you could take a look at it. And if you're part of a hospital team, respond. If you're not part of a hospital team, I ask you not to respond, but feel free to include suggestions or your ideas or thoughts in the chat. Let us know what you think you will use, because this will help us how to set up our red cap, and then also how to help you. Cool. So we're getting responses. As that's coming in, I just want to call out another comment that is DM'd to me in the chat that I think is a great point. And Jennifer Holloway says that a lot of this work is focused on postpartum. However, L&D serves as an ER for pregnant patients in general, and really needs to be, this really would need to be completed on all patients, not just those that are admitted for birth. She says we can miss many opportunities for intervention if we aren't utilizing methods for all visits. We completely agree with that. Yeah, feel free to use it for all patients. Okay, so I think we have a good amount of responses. I'm going to end the poll and share the results. So it looks like 62% of you said you're going to use the patient data form. 0 said you're going to aggregate data from the EMR. Selfishly, this makes me very happy because I think it's going to be better for all of us. I think all of our lives are going to be easier. And the care will be better for the patients. And then 38% are not sure. That's totally fine. Obviously, this is the first time you're seeing this patient data sheet, so that's okay. If you're not sure, of course, like, let's work on in the next month, figuring out the best path forward and figuring out who we need to talk to see what the best path forward is. Curious just to spend, 1 minute, if you want to put into the chat, why you're thinking you want to use the method you select, or if you have any other ideas or plans for data collection that you think would be better, let us know. I am going to move on to the next slide so that we can finish on. The next slide is next steps. Don't worry, again, you're going to get an email, and we hope this is overwhelming. Actually, not as many things as it looks like. So by March 1st, you're going to submit that first qualitative survey to us. You will get an email with the link to where that survey lives, asking you to complete it. So you're not missing anything. You don't have that link yet, we will send it to you. Please send us an email with the email addresses of any other staff members that you would like added to our contacts, beyond your champions. We have your champion email addresses, but if you want us to invite other people to things or add other people to the newsletter so they get the resources, we would love to do that. Just send us an email, ideally a spreadsheet with people's email addresses. By March 10th, you're going to submit those RN culture change surveys. Elena we'll send all this in an email. We'll make sure you have those surveys. You don't have them yet. We ask the nurse manager or whoever your nursing champion is to distribute those to the rest of the nurses on the staff who aren't necessarily part of these calls, so that we can get that done. Secondly, I don't think this applies to anyone, but if you have not had an expert training, or you haven't had one lately, or if you have new team members that could use an expert training, please reach out to our partners at Peer Assistance Services. They provide free expert trainings in Colorado. We recommend you reach out by March 10th to get it scheduled, but it doesn't have to occur by March 10th. And our partner there is Kevin Hughes at Peer Assistance Services, and you can email him. We'll send you this email address via email, and recommend you get that set up for anyone who hasn't had an expert training. Next, once you receive them from CPCQC, forward the data use agreements to contact. For 2021 teams, this will be just an update of the DUA you completed last year. It just will list the new measures. For the new teams, it'll be an entirely new DUA, that you send that to your contacts at your hospital and try to get that back to us as soon as possible. Luckily, you don't need an executed DUA to submit the qualitative info to us. you will need to submit quantitative. So we want to get that process in motion as quickly as possible because we know it can take a while sometimes for your hospital departments to execute the DUAs. Next, by March 1st, just internally, make sure you're reviewing key dates and register for this call series. Check when your hospital's presentation dates are and save the date or let us know if that date won't work for you. Set up internal team huddles to make sure you're discussing this project at least monthly. Try the test of change that you plan today on that PDSA worksheet and then complete the worksheet. Reminder to check out the team resources folder. It's chock full of good stuff, and there are a lot of resources in there that are amazing and can help you right off the bat. We're going to share a project guide in email that you can read, so you can read more about the details of this and the change concepts all in one place, see evidence for all of this. It's going to be fabulous. And then lastly, begin internal data planning and meet with us before April 1st to plan for data collection, because April 1st is when you're going to need to start collecting that quantitative data. Lastly, this is the last thing we need. Please take our exit poll in Zoom. It should be up on your screen right now. We would really appreciate if you take that, especially if you're a hospital team. If you're not a hospital team, these questions aren't necessarily relevant to you and may mess up our evaluation. So you don't have to take it if you're not a hospital team, because we really want to know if we gave hospital teams what they need today. And as always, you can email us at info@bcqc.org to reach all of us at once. If you don't know email, any questions, support you need, anything at all, please email us. And again, we'll send out a follow-up email with everything you need, with these slides, the worksheets, the link. And that's all. And we can stay on for a couple of minutes if people have questions or anything you want to discuss. Feel free to jump off. We're at 1 o'clock. But thank you all so much for being here today. And we are genuinely very excited to have this work going in 2022. Okay, well, it looks like most people have finished the poll. This is super helpful for us to know what people aren't feeling great about. And yeah, we can stay on for a couple more seconds. If you have anything to discuss, let us know. And if not, we can end the meeting.